characteristic for eosinophilic granuloma.
That's right. I believe the alternative diagnosis is eosinophilic granuloma.
What about the prognosis? The radiograph showed no hard tissue involvement, so surely it is good.
Indeed, Mr. Jones' case does have a better prognosis than, let's say, a case with pulmonary involvement. Eosinophilic granuloma, the recurrence rate of eosinophilic granuloma ranges between 1.6% to 25%, depending on the treatment method and the location of the lesion. The lowest range applies to those who get treated by radiation or surgical excision. However, if it does recur and reactivate, it can lead to chronic local symptoms or even induce organ dysfunction.
From what I know, hematopoietic malignancy may be associated with eosinophilic granuloma. However, it has only been reported in a few cases. In fact, the prevalence of eosinophilic granuloma is 1 out of 2 million. Some literature states that the hematopoietic malignancy is related to the treatment received for eosinophilic granuloma, while others consider the eosinophilic granuloma to be an immune response to the hematopoietic malignancy itself.
Well, speaking of treatment, I actually know a thing or two about it. So basically, the treatment relies on the number of granulomas present, the number of body parts affected, and the degree of dissemination of the lesions. The lesions are usually monostotic or polyostotic, meaning that it can affect a single bone or several different bones. Sometimes it's also seen in the soft tissues. And their local expansion is what determines the treatment modality that's chosen. Now, there's no golden standard for the treatment of eosinophilic granuloma yet. And unfortunately, the treatment choices have a wide variety from simply following up with the case, taking simple biopsies, incisional or excisional, curettage, irradiation therapy, chemotherapy, or sometimes even in more complex cases, block resection. These can be done individually or in combination, depending on the case. More extensive procedures done to the patients will cause more complications because of the more variety of tissue manipulation. And this is why most complications with eosinophilic granuloma patients are from the treatment itself rather than from the disease.
I'm on the same page. Complications like fracture of bone during curettage, development of certain conditions due to chemotherapy, not to mention that treatment with radiation therapy is avoided in small, localized lesions and reserved for disseminated forms of the disease.
Follow-up investigations and monitoring of the functional impairments of the disease are necessary. Restaging every 2 to 3 months is standard. Follow-up intervals really depend on the extent and activity of the disease within 3 to 12 months.
All right, well, thanks for your help. We'll put it to use.
We'll deal with Dr. Ashif.